UJYN 98.5 FM. You can go to YouTube. We are streaming live where you can see myself, the president of iDay, Mr. Joshua, who's an RN, and Dr. Pitts. We talking COVID, y'all.
Yes,
What's
yes,
up? Do y'all
indeed.
have questions? You can call in 215-763-9596. You have a COVID question. I asked some earlier, and I hope that they provided some more information. Not so much the question, but in the discussion that we had afterwards, right?
Right,
We
right.
brought out some good points and some things that I did not know personally about COVID. So I want to say thank you to all three of you for being here and for what you're doing in our community.
Absolutely. Like you said, it's about creating a safe space where we can just come together, provide, facts, education,
Right.
because getting a vaccine is a personal decision. So we
It's
want
a
to,
big decision.
yeah, a big decision. Yeah, yeah, yeah. We want to make sure we have the resource to pull from. We're making that decision.
We want to
Correct.
thank you for giving us a voice and
Oh
lending your
yeah,
voice in our
that's
community.
that's that's what we here. We're here to push you guys forward or the community forward.
Yes.
And
No.
thanks for allowing us to be in this conversation. We
Oh
go
yeah.
out into the communities and we ask people to at least participate in the community in the conversation,
Right.
and there we can begin to discuss and listen to what each other has to say.
Correct.
So thanks
Yeah.
for this opportunity.
That's why, right. That's why I led with, I'm not going to ask you questions that put you in the corner. I know sometimes when you go on shows and you do interviews, people have strategically tried to manipulate. That's not what we're about here. We're about education, enlightenment, and empowerment, right? So the more you know, the better you can do, right? You'll get better results. And then
Yes.
you'll know how to move moving forward. So, like I said, I don't want us to be behind. I don't want us to be without information or resources or access. But we all got to come together to know what's on the table as far as resources, access, and
Mm.
what's available,
Right.
right? So I think us being separated because of COVID has caused the most damage, right? Due to the lack of being around family all the time.
Right.
And the spread of information has slowed down because you're not around everybody you were around before. Remember, you just, oh, I hear about it, but everybody else knew, and they
Right.
caught you up at the end of the day. Now it's, I'm on my phone, and well, this article can,
Right.
kill me with the articles and the fact checkers, and
Yeah.
just a lot of people throwing these things out to cause you to not want to conform to getting the vaccine, and that pushes very hard.
Yeah, I think that's another threat. So, vaccine hesitancy is just the disinformation and misinformation that's out there in social media, such as Facebook or Instagram,
Yeah,
that may not be fact checked, but because it's online and people may
right,
believe it.
right.
So that's the stuff that I love to listen to and
That's the
dispel.
That's the source of information for the youth. Is
Oh
Instagram.
yeah, but they go
Yeah.
online real quick.
Like
And we don't have relationships with primary care providers.
Right.
That's missing
Mhm.
in
Right.
our communities, and we really have to do something to strengthen that relationship.
Yeah.
Right. So when you were gone, we were talking about, just from a mental standpoint, historically for us, going to the doctor is a no-no. Right? It's like, off the table.
I was going to ask. So
I'm
being
not
as
gonna
though
do
our
it.
show is an extra long show today. I had went outside and treated my endocannabinoid system because I can't do that in the studio. You know what I'm saying? Like I said, I'm a God-fearing man,
Mhm.
Yes.
and I don't lie. I have this terminology. I say I'm free.
Mm.
It's a wonderful feeling. If you don't know what it's like to be free, you need to be free. I am 100% comfortable with myself. I am 100% comfortable with everything that I do,
Mhm.
and 100% comfortable with everything that I say.
Mhm.
It's not a lot of people that have all three.
Right. Right.
Right.
Look, I feel better about
You know what
my
I'm saying?
stance
Yeah, that's-
on the vaccine.
And when and what I do is when I'm around people that if I see them lacking one of the three, I encourage them to work on that,
Yeah.
to be free. You know,
Right.
like when I said to you, you a smart guy.
Right.
You are the future.
Yeah.
Yeah.
You should be somebody that when you walk in the building, Josh is in here.
Yeah.
And you taking the time out to go to school and educate yourself and to do the things that you do, you're learning something that somebody like me don't know. So when I smoke, I like being around people like you.
Right.
I absorb that knowledge.
Right.
Mhm.
Makes me smart so that I can go pass that along to somebody else.
Yeah, help somebody else out.
The each one teach one
Mhm.
situation.
Yes.
And that's what it's
That-
about.
Yes.
Because
That's absolutely right.
that really does work.
It does,
Yeah.
especially in our community too.
Passing information from one person to another,
Yep.
not just off the phone.
Right.
I would get more talking to you than I would ever get from a meme
Right.
Mhm.
Right.
Mhm.
Right. Or a text message.
or a text message,
Yeah.
right?
Mhm.
Me and you could sit down for hours and we may agree or disagree, but
Mhm.
we're gonna come to some common ground and we both gonna walk away from that conversation with a little more knowledge than what we
will learn something from each
gonna
other.
we
Yes.
gonna
That's
learn
right.
from something. from each other.
Absolutely.
So that's the whole point. You know what I mean?
And that's why it's important to listen to what people have to say.
Yes.
Right. And, as we listen, not think of the next thing that you're going to say, but generally listen,
Right.
Right.
so that we can understand where each other is coming from. Right.
I like to debate with people, right? So, and the one tool in debating, the best tool in debating is listening.
Yep.
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 Absolutely.
Because I want to hear what you say so you
Right.
can trip over your words. So when it's my
Gonna
turn to
address it.
talk, when I got the floor,
That's it.
Mhm.
I got you.
Right.
You said that. You said, remember how you said what you said? And I said, no,
remember.
sir, you said this. I caught you. You
I
tripped.
still have
listened.
questions about that, but that's okay.
It's cool.
That's okay.
It's cool, but I was right.
Right.
I was right. I said, oh, I caught you. You thought that. That's what you said. But I had to listen in order to hear you say that.
Mm. Mhm.
So no, I'm a good listener. Like him right here.
Spurred something.
I like him.
Hey,
He sat back there and he folded his hands.
I'm gonna hear what's going on.
And he was taking in this,
Mm-hmm.
he was taking it in.
Mm-hmm.
I was letting him know just because I do customer service at work, so I talk very, very proper at work. So when I'm not on the clock, I swear I can't talk proper at all. It's like I can't do it. I can't do it. But some knowledge was coming out of us.
Right.
And he went like this. So no, I'm gonna let them two talk. I'm listening.
You said something that spurred a question that I think the listeners need to hear.
Mhm.
You said you had COVID,
Mm-hmm.
but that spurred a question to me that I think I know the answer to. But I'm actually going to ask it so it's officially we can hear our people can hear it from our
Yeah.
doctors.
Okay.
Which is, if you had COVID, are there documented cases of people having COVID more than once? Can you get it again?
Yes.
You can.
Absolutely.
Yes.
So I haven't heard nobody getting it more than once. I'm waiting for that. I have to be 1,000%
I
honest with y'all.
have.
I have a question to follow up on that question.
Mm-hmm.
Yeah, I haven't heard nobody
If you
catching
did
it twice.
Again, is the chance of you dying is that chance then decreased, or is it still the same chance of you dying as you had in
The first time.
So,
episode?
so we don't know what's going to happen that second time. All right. Because you have gotten COVID the first time, your system will develop an immunity to that. Josh said earlier that it lasts about 90 days.
Mhm.
Absolutely true. Right. After that, your immunity level decreases
Like
over
to the
time.
74, like I heard I was
You
listening.
heard, you were listening. There you go. All right. And because of that,
Right.
except that when you have your own personal immunity, natural immunity they call it, right?
Mhm.
That decreases to a level where you are unprotected, right? Because you don't have now the antibody protection that you would otherwise have. Therefore, you can contract COVID again, and you remain unprotected after that 90 days. You can develop it again, right? And we don't know what's going to happen that next time.
Yeah. You went to 90, then the 90. 90 plus 90 is 180.
That's 6 months.
That's a lot of days.
It's a half a year, 6
I
months.
only know math when it comes to my money. When I gotta do math when it don't got nothing to do with my money, I don't know the answer.
6 months.
Yeah, I was, huh? What you
6
say?
months of immunity.
Yeah, see how she said that? All right.
So
That's-
I have a colleague who, like I said, he caught it twice and he is vaccinated.
Mm-hmm.
So I was concerned. That was a little reason that led me to be hesitant.
Right.
Mm.
But just, physically looking, is some other things going on with this individual, and I think that contributed to them catching it the second time,
Mm.
even though they have gotten vaccinated. So he works in healthcare, and they go around to have some missions going on to help undocumented children, and border patrol, those different environments, right? And I believe because he was all in those different environments,
Yeah.
it exposed him even more so because it wasn't familiar, right? It wasn't just people from the United States. You had a combination of a lot of different ethnicities or nationalities, right? With different types of medical dispositions. And I think that contributed to him catching it again. So the back-to-back, I don't know if I can do the back-to-back. COVID
Like
twice.
I said, it was the longest bug
think I
I
wanna catch it
ever
twice.
had in my
Right.
life, and I never
Yeah.
felt like that in my life. I was like, "Yo, what? This the COVID? Oh my god!"
Right. I wouldn't wish
So
it
the
on
question
anybody.
is, the
Yeah.
I was
is-
like, "Yo, like I couldn't eat." like
So-
even thinking about a cheesesteak or a burger, it was.
do you
something
want-
heavy like I
Do you want to experience that again? And Lady
That's the
Steph was
question,
saying,
yeah.
no, I don't know.
No, I mean, I feel like
That nerve
I
pain
was
board
in close proximity of somebody who had it, so we don't know. I don't know how that person got it. So you know what I mean. But other than that, I don't be around a lot of people anyway. I'm 40 years old. If you get up in age in life, you don't be around a lot of people anyway. You start to social distance anyway. So
automatic.
yeah, you social distance. When I was young, I had 50 homies.
Is it?
All right.
I got one now.
Hey, you learn how to choose your friends.
Look,
Right,
but you don't
right.
have to repeat yourself 49 times.
Yeah, how about that? I ain't never.
That's how I look at it.
Yeah, you know what I'm saying. So I'm social distance. Everything about what we do is all business. I have all business associates.
Gotcha.
We have a whole host of them. You know what I'm saying. Shout out to all of them that's listening. You know what I'm saying.
Yeah.
Shout out to all, but we social distance anyway.
Yeah.
So do I want to get that again? No, I don't. But I ain't want to get the bug again.
The first time.
when I was getting the bug, I ain't want the bug neither.
Surprisingly, I'm a person who does not get the flu vaccine
I ain't never had that.
because I don't catch the flu.
Okay.
I mean, I haven't got the flu in like 30 years since I was in college,
Mm.
and I'm in my 50s now. So I was like, why would I get the vaccine? But when people I know had it, I asked them. Everybody I know that got it, I asked them how bad it was, and I said, would you get the vaccination, not knowing that you had it? And that's what convinced me. They were like, this is the worst. And they were like, I would definitely, and they all got the shot because after experiencing it, they're like, whatever side effects I might have got from it is not as bad as with the suffering through COVID.
Well,
And
they
that's
need
what
to.
convinced
Y'all,
me.
well, then they need to shut down. Lord forgive me.
Shut down.
They need to shut down Robitussin and NyQuil and Dayquil.
What's that?
Because as long as they got that on the shelf, people like me gonna use that, and we fighting it at the crib.
I hear you.
Right.
I hear you.
I'm just
The problem
saying,
is,
it worked.
well, we don't know that works.
It
Man.
did.
Look, here's the
did.
thing. That does not
It
have
worked.
any antiviral effects.
Listen,
Scientifically,
I took some
it has none.
Dayquil. I was up good.
I know, but they
you know
were
what I'm saying?
to
Looking good.
treat
I
symptoms.
was drinking my tea all crazy.
I said this
Symptomatically.
Yeah.
You
At
were
night,
comfortable.
Your,
at night,
your
at night-
reaction to it is what it's treated,
At
not
nighttime,
the
I was
problem.
taking my
Right.
NyQuil.
Essentially, yeah.
I ain't gonna hold you. I was waking. Yo, sweat. Oh man. Yeah. I'm gonna let y'all know I was going through it. I'm not gonna lie to the people. I was going through it.
Mhm.
Going
So
through it.
you know what happened, right? So the Robitussin, if you had been coughing, Robitussin took care of the cough, right?
Right.
NyQuil took care of the cough.
Yo,
Some
no,
other
because
symptoms,
on the-
but it
because
did
on the
not
days
do
I had
anything for the
headache, I had to
virus.
take some days I had to take some Tylenol. My head was
Took care of the headache.
Right.
so I was,
Those are symptoms.
I was
Yeah.
like I said, I did what I self medicated at the house, drank a lot of water, a lot of juice,
But you weren't going to see a doctor. Why not?
I ain't want to. I felt like I got one for you. I got a good answer for you. I felt that the stuff that I learned from Dr. Mom was good enough. That's an answer for you.
So
All right.
that leads
That's an answer
No,
for
no,
you.
no.
The way Dr. Mom took care of me when I was a
Mhm.
kid, and she kept me alive.
Love and care.
I went with the Dr. Mom tactics,
Yeah.
and it worked out for me. You know what I mean?
leads to a good question. According to the research, the CDC does not recommend everybody that gets COVID go to the doctors. Go to the hospital. So,
Right.
Okay.
according to what we have out there, what is the recommendation for when a person should go to the hospital?
When you cannot breathe.
You can't breathe. I was about to
Can't
say, if I
breathe.
can't breathe, you can't breathe.
Well, hold on, because your respiratory system might be okay. It may be a different aspect of COVID. I didn't have any problems breathing, but that nerve pain,
Right.
totally different.
Mm.
That was boss level, Aaron. It was like somebody had a hand and was just all my nerve endings. I said,
Mhm.
"Oh, what is that?" I would not wish that on anyone. So it
Yeah.
depends on how you react to it. But like I said, getting it twice, you got me thinking. I don't know about that second round. Once was enough.
Mm.
You either learn from associating with those who've gone through it,
Right.
or
Right.
you learn from experience. I've done the experience. Now I'm talking. I don't want to do no more experimental testing to see if I can fight COVID. I'm good. One round is enough. I
The
think
disease
that's-
is very unpredictable.
Yeah.
Very unpredictable. And,
Yo, how come the place
And it's
that
different
had
every
it, that's
person.
where it started
It
from
is,
don't
really
even
is.
talk about this no more?
Some people have
Like, why
nausea.
the US,
I did
we drowned in it.
whatsoever.
Some
I
people
had a
have heart
headache.
pain.
Yeah.
Where Wuhan,
Yeah.
China?
Correct.
Wuhan, China don't even talk about the COVID no more.
I don't know
Once
why
it
they
came
talk
over
about
here to
that.
us, we just so engulfed in it. Like
Yeah.
the rest of the world is not engulfed in it. Well, how did we get engulfed?
Well, travel, as we know, the virus spreads by droplet, by breathing in droplet that's aerosol in the air, just in within 6 feet. So, with how global we are now, a disease, that started in another country ended up in the United States. And, it's just,
You know what I'm saying? Now,
Mhm.
they, the way that we talk about it and all the stuff that come with it, right? And other places all the rest of the world, they not like us. So that's what I'm saying. Like, how did we get so engulfed? Like like the COVID bug, we got bit with it.
So,
I'm trying,
globally,
Yeah.
so globally, all of our nations treat this differently, and all of the citizens of various nations in the world respond differently to their leaders. I was talking to somebody just the other day who was talking about them actually they traveled to Sweden,
Mhm.
and they're saying that the people in Sweden are talking about COVID in the past tense. And she's a professor, and she asked about, well, why is
cool
that?
is that?
He said, well, when our leaders say there's a pandemic and we should get vaccinated,
Yep.
we get vaccinated, right? Same thing in Wuhan, China, or other places over there, and in communist countries, right? In which say when our
what about
leaders
the
say
man from
something,
Jamaica? The man from Jamaica said,
well,
we ain't taking it until after we see what happened to the Americans.
right? And so that's
When
exactly
somebody
right.
like me see that, I said, whoa, wait a minute.
Because in countries
Why he said that?
Hmm.
in countries
I'm going
where
to
they
Jamaica.
believe that free choice is, it's an option, right? They say, well, I got this thing
I
called free
should be
choice.
able to choose.
I take it if I want to. I don't have to take it if I don't want to.
I should
right?
I should be able to choose, and I think that's the big problem.
But that's
right
the
now.
difference that we're
I
talking
think
about.
I think whoever handled the PR for the COVID, they did a bad job.
Right.
They did a bad job.
Right.
Because you telling me to do something is something in me that
Just naturally wants to
wants
rebel.
to say,
You're not the
Right.
boss of me.
man, I ain't doing that because
Tell
you
me
told
what to
me
do.
'cause you told me to do it.
You
So
know what?
that's really I'm gonna be 100 with y'all.
Mhm.
That's
So-
probably 50% or more of the problem.
Right. Yeah.
Is the fact that y'all people trying to make people like, yo, you trying to make me? No, now I want to question it. I wanted this. I'm
Right.
telling. That's when the Macon came into play. That's when people was like, "Hold up, man."
So
Right.
let me just say
If
something.
they would have handled the PR a little different, everybody would have been. We probably wouldn't even talk about this.
Yeah.
But y'all said, "Make me do it." Wait, yo, don't make me do nothing. Right? Wow, what's going on?
Well, it's a matter of personal choice, as you're saying, and in this
the
country,
PR people handled it wrong.
We
Now good
believe in
brothers like
personal
you
choice,
was
right?
handling PR in the
Right.
hood, right?
And you're helping
Right.
us.
Right.
No, right. That's what we doing.
Yeah.
Because obviously the PR, they did a bad job.
Right.
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 As a whole, they
Right.
they botched this situation.
Right.
So now we got good brothers explaining to other good brothers, why you should do this.
Yeah.
And we giving out data, we having great convo and all that
Mhm,
because we
mhm.
trying to repair the PR job that was done.
Yeah.
Right.
The PR
The
job
damage.
was done.
Yeah.
Whoever handled the PR when this came out, they did a bad job.
Right.
Soon as they said, "I'm gonna make you do it."
Mm.
Right.
Well,
Mhm.
if it's a good idea, right? That's what we're here talking about. It's a good
Right.
idea. It's gonna do this. It's helpful. All the great stuff that we saying.
Mhm.
I should want to get that, right? Right? It's a
Right.
great idea.
Right.
Most
So why aren't people wanting to do that
Yeah.
when brothers like yourself is saying it's a great idea?
Right.
It's because you told me I gotta do it. No, I'm not.
Yeah, I think-
I'm not doing that because you told me. Who you think you is?
Yeah. I think naturally when we hear something that you have to, just like you said, naturally, you kind of
Right.
wanna
Go to
have a
bed at 9
resistance.
o'clock.
You wanna have a
Listen, man. When
resistance.
you was growing
I
up,
think
your
10
mom
o'clock
told
is
you what to
better.
do.
Right.
When your
Right.
mom told you what to do, right?
Right.
When you got out your mom crib, what nobody tell.
Right.
I got a job. I work for somebody. I don't lie.
Mhm.
I told my supervisor, I said, I respect your position, but we are men first.
Mhm.
And you must respect me as a man first before I respect your position.
Mhm.
Otherwise, I can't be in a position to be around you.
Right.
I had a situation, and then that's why I had to address that man in that way. But I address all men that way, and I, looked that man dead in his face and said, "No, I'm a man first. You're gonna respect."
Did Dr. Pitt, did you have something you
Yes.
wanted to say?
You know what I mean? So what I'm saying is that's why you get told what to do for 18 years. I'm grown now. You ain't
Right,
telling me
right.
what to do.
Right.
Yeah, no, all I was going to say is that, there is that whole issue around personal choice. And in this country, we cherish that freedom, right? In other countries, and
It ain't so free.
right, it ain't so free.
The laws are
That's
a little
right.
different.
Because you just said that you said the man said, when our leaders say do this, we do it.
Right.
Right.
Yeah. Not so much here in this
Right.
country.
Yeah,
right?
that's not like that.
And so,
over there.
and so particularly in African American communities, right? And so we
Nobody
have
want to be told what to do.
nobody
That's
wants to be
community.
told what to do, particularly in healthcare, and particularly when we talk about things like the Tuskegee experiment.
Mhm.
Right.
We talk about Henrietta Lacks and all of that.
Right.
Oh, I was going to
And-
ask y'all about that. I'm so
Yeah.
glad you said it first.
Yeah.
No.
I
mean,
wanted
I'm
you
a
to know,
vet,
know about
so-
that.
Yeah.
That's
I wanted
absolutely real.
you to know us our people know about
Yeah.
that.
Yeah.
Because of
That's-
stuff like that, we be like, oh, because see, once again, the PR job got botched.
Right.
So now it made us bring that up.
It made you bringing that up. And also, what people don't recognize is that in communities that have been ignored for, like forever, right?
Still being
So
ignored.
now, and still being ignored, and now you're going to go into a community and you're going to say, okay, I have a vaccine that's going to prevent this disease. And the question is, are you going to believe that?
Right.
From when you've been ignored for all this period of time, right?
Mhm.
And so you really have to give credence to that attitude and say, okay, what are we going to do about this in order to establish some sort of trust and some sort of credibility in these
Right.
communities?
Yep.
That and people are not doing that work.
Right.
They're just going into neighborhoods and saying, okay, this is
You
going to
better get it right.
Yeah.
You better get it right. And so that's where the issue really comes in.
Yeah.
As soon as you hit the
African
better,
American,
see
yeah.
how you said that word? You said that word. You said better get it.
Right.
I ain't
Does it better?
I ain't better did nothing.
Well,
Well,
I'm
let
just
me-
saying.
Yeah.
Let me
Yeah.
tell you, what I started off, started off, and we still are working with the Philadelphia Department of Health.
Mm-hmm.
And we saw the message they had, and I'm thinking like, this message is not going to go across to our people.
right.
So
Right.
I was like,
Right.
we have to figure out. I consider myself a leader in the black community,
Mhm.
and they're leaders in the black community. Why can't we work together to present this another way so our people can get the
Exactly.
message?
Yeah.
Exactly.
I'm glad y'all here for that.
And make an
Yeah.
I'm
educated
glad y'all saying
decision.
that. Y'all saying
Educated
so I'm
decision.
amongst leaders in the black community because I'm
You are a leader. You're
a leader
doing
in the
this
black
show.
community.
Mm-hmm.
No, without this show, I'm a leader in the black community.
Mm-hmm.
And
I have a question for each of you three gentlemen individually.
Mhm.
Yes, sir.
please,
Two
Mr.
questions-
Shooter.
Two questions actually, but I'm going to ask you first, Doctor. The first question.
Mhm.
Do you think there could have been other solutions or preventative options before this even took place? Do you think there were things that we could have done? And I'm talking about the higher ups, obviously, the people that had more information than us. Do you
Mhm.
think there are other things that could have been done to prevent most of, or to kind of curve,
Yeah. So absolutely. I mean, when we talk about the history between the relationship between African American communities and the healthcare
Mhm.
industry, and it is an industry. We're talking about how over years, this whole thing that we're talking about with regard to healthcare disparities, we're talking about how implicit bias plays a huge role in how people are treated in hospitals and in doctors' offices, and all of that has contributed to this wide gap in relationships, right? And so when you talk about people being afraid of vaccinations, that really is at play here. Now, what could have been done is that early on, we could have had this trust between the healthcare industry and the community. We could have all those implicit biases we talk about.
Mhm.
We could have addressed them early on. But what you see going on now has been going on since the end of slavery and beyond.
It's deeper.
Right.
Yes.
It's
Okay,
deep.
okay, that's
Right.
Yes.
okay.
Yes.
We
And
Which will
Yes.
bring me to my second question.
mhm.
Do you think there's a political connection between the coming of this virus and our government? Do you think there's a political connection between everything that's going on?
I don't think if you're talking about the evolution of the virus itself and that being politically motivated, I don't see that there's any connection there. I do see a connection between the politics of COVID
Mhm.
and whether or not people now are availing themselves to, like, who's getting the services
Mhm.
and who's not getting the services. I do see politicization there, right? And who we identify as, say, frontline workers, for example, and who we are exposing, to the virus even before the vaccination was available. There perhaps is some political connection there.
Do you
But-
think there was a choice in? Do you think the political side of our country had a choice in who they provided the information to first?
Oh, absolutely.
Do you
Yeah,
think they
yeah.
were biased about it?
Of course they.
I think we always have bias.
I wanted to ask a doctor.
I think we always have bias. To be quite honest about it, I think we always have bias. And bias is in the air, right? And and even in those instances where it may not have been intentional, I think bias is still in the air, right? And so you're going to the people who have access to the information to begin with,
Yep.
who had access,
Mhm.
they're going to continue to have access. Those people who didn't have access, well, they're still on the fringes,
Right.
right? So a lot of that is at work still.
Yeah.
And so we got a lot of work to do.
Yeah.
Mhm.
No question about that.
Right. And just to piggyback on that, as a healthcare professional, the doctor now has access to looking at research. We got trained on how to disseminate and analyze research, and we have the like necessary training to like tell when some research is like is biased or is not generalizable to the United States population, where the rest of the community don't have access to that research and are getting information from word of mouth or or assumptions of what they saw or what they think about other people's health conditions or health status. So I think I'm grateful that we have this platform where we can help disseminate that information out to the community.
Absolutely.
And I want to get back to some basic questions that I think some of our listeners might benefit from.
Okay.
So we're at boosters now. So officially, while we have you guys here, how long should it be after you get your shot that you should get your booster?
Yeah.
So wait, you need a booster for all 3 versions?
Yeah. How many
The Johnson
times
Johnson, the
they got
Moderna,
boosted?
and the Pfizer, they all have a booster?
All
See, I didn't
com-
know that.
All companies got boosters.
I didn't know everybody had the
So,
boost.
so because they've been doing a tremendous job of like continuing, even though we're disseminating millions and millions of vaccines, they're still doing research,
Right.
looking at how effective vaccines are, and this will be an ongoing process, just continuation looking at effectiveness and safety. And what they found is that 74%, like the immunity kind of wanes over time, and so
The booster helps.
boosters, yeah.
So wait, I got to be boosted the rest of my life? Is that what you're telling me? Or is that one shot? Or is it going to come into like, how they do hepatitis? I'm sorry, or your tetanus shot.
Right.
You
They just
get,
ban
it's,
you one
it's good
time.
for an increment. And then it's like, you need to get your second, series of
Yeah.
the entire set as far as your immunization is
Right.
concerned.
So we'll have to. So what I'm saying is we still have to do more research into
okay.
that, but for now, looks like at the time being, you'll need to get one booster.
Okay.
What about the
6
pill?
months.
Oh, they say they're coming out with a COVID pill
What
to
about the
prevent
pill?
hospitalization.
They coming
Yes.
out with a COVID pill. Wait a
That
minute.
COVID pill.
You a doctor? I know you heard about it before. I did.
Yeah. So it's 2 things. So vaccines is for prevention, and then you got the pill.
Yes.
That's a treatment. So
Yes.
like after you contract COVID,
That's
if
when
you're
you take
at
it.
risk for severe death or hospitalization, it's supposed to reduce it by, I believe, 84%.
Yeah. Right,
But that's a treatment though, and then there's prevention, which is the vaccine.
yeah.
So, if they come out with a pill that could do that, can somebody like myself say, you know what? I don't want to get the vaccine, but if I catch it, I'm gonna go to Walgreens
Right.
and I'm gonna take the COVID
But
pills
you
because
see,
y'all tested them and they good.
You see, there's a key word that you use. It's if I catch it. Now,
Right.
ultimately, if you are not vaccinated, the chances are very, very high that you will catch it.
Okay,
So it's no longer a
so
And
when I
if
get it,
it's a win.
okay,
win.
so when I get it,
Right.
they doing all this government trials, so they got the pill now.
Right. So
I got this
I
some water and I'm good.
no, I do want to add this though. Because of COVID, like you can be asymptomatic, the spread of COVID. So like, yes, you might be healthy, you might be able to fight the virus. Me being in the healthcare field, I see people who can't fight the virus. So it's not about, and the reason why I got vaccinated because I wanted to protect myself, but I also I feel like I have a duty to protect our vulnerable population, and that's our population who's immunocompromised, who
Yes.
who are fighting cancer, or have AIDS or HIV. These are people who are faceless, who won't tell you their health status, who
But they can secretly take the pill now. Is that Walgreens? Is that Rite Aid? Is that
said it was
CVS?
It was prevention.
How would you feel if
Yes.
you took that approach and you gave it to one of your family members and they weren't as fortunate as you and they died? I mean, because you can still pass it. When you have the virus, you can pass it to 4 or 5 other people. You don't know which one of those people might not be as fortunate.
But see, now I'm listening, right? So let's say I get the shot. I don't know when my 94 go down to 70 something, and now I need to get boosted. I can still give it to people like you said.
but you're also like decreasing it significantly. This spread.
You saying I'm
From you as the
decrease-
source.
You know what I'm saying? I'm
You don't
decreasing it.
become communicable.
Look, I'm decreasing it,
Mhm.
but it don't mean that it ain't. So that means there's the possibility that when I'm at 79, I could pass it to somebody because my thing went down, and now I'm in pass mode because I ain't high.
Mhm.
I'm listening to what y'all saying.
Mhm.
So the lower I get, the more I'm in pass mode.
The longer you wait.
Low. So now I'm gonna get my booster next week, but this week I passed it on to Auntie. I don't know that I did that. I went and got my shot.
Right.
I'm about to get my booster, so I can boost back up to 90.
Mhm.
Right.
Right.
I'm doing what y'all said.
Right. But you're even
I
more
can
you're even
still-
more protected now, and you're protecting Auntie even more so if you didn't have your vaccine.
And if I,
But
So-
here's the thing. So all right. So these are circular conversations, okay? Because
I'm trying to get
I
the
mean,
definite.
basically,
We need the
I hear
definite.
you.
We need the 99.9
No.
like the DNA test.
but here,
To
Ray,
fight
Ray,
We need the
listen,
99.9.
Yeah, I hear you. But,
Nothing is
but what we're trying to
99.9.
do, what we're
That's
trying
what
to
the
do
DNA test
is
said.
get everyone,
That's different.
as many people as possible. Hear me carefully, right?
Yes.
Get as many people as possible vaccinated, so we can get to this thing called herd immunity, right? You heard of herd immunity, right?
No, break it down.
Never heard. So
No.
herd
We
immunity
don't know nothing about
is
that.
such that if you get enough people vaccinated in a population, then the transmissibility of the virus decreases substantially enough that the virus has literally no place to go, right? Because it looks for human host. Literally, this is how viruses behave.
No.
It looks for human host.
You breaking it. See, you
Right.
should have been a part of PR. I like what you're saying.
Well,
This
that's
is PR.
why we're trying to deal with the facts.
Like Venom.
And
And
when
look for the host of the person to
it
jump in.
looks for hosts, and it will go from this person who is unvaccinated to another person who is unvaccinated to another person, right? When you have herd immunity and someone is unvaccinated, well, there's nobody else for it to actually go to, because the other person is vaccinated, and this person is vaccinated, and that person is vaccinated. And that is the way in societies, that's the way viruses disappear. That's the way. That's how they die and they go away. We don't have to use these masks anymore. We can get together with our families. We can get together with our communities. All right. And so to the question about whether or not we get vaccinated on a yearly basis, or we have boosters. If you have enough people in a society
It can
who
go
are
away. I hear
vaccinated,
what you're
it
saying.
can go away, and it won't replicate, so that we develop these mutant these variants.
Right.
And that's
then
what
you
we're
don't got to
after.
keep getting it because it's gone.
That's right. Exactly.
Then see if people would have came out and said it like that, and then
I just
talked
said
on
that.
that one,
Mhm.
y'all might have got it. Y'all would have had it sold.
Well, this where my bias question comes into play at. There's still pockets on our planet where there's like specific viruses that are still prevalent, and I want to say viruses that we've been exposed to over the past. I want to say let's say 20 years.
Mhm.
The SARS, the Ebola, the Zika, the
Bird virus.
you know what I'm saying? The
Mhm.
swine flu, bird flu, all those they're still here. They haven't actually disappeared. But
We're
if
not
we're
getting
doing all of these
doctors.
things, we're doing all of these tactics, why are they still here, first and foremost?
So
And if they're still here, why aren't our treatments still in play? Why are we still?
So if you look at most of the world's population with regard to where vaccinations and other treatments are available, you can perhaps map the places where these diseases, these viruses, etc., are prevalent, because they might be prevalent in places that do not have access to the vaccine. Case in point, the virus has been especially prevalent in the Midwest of the U.S., right? And in the Midwest of the U.S., particularly in areas that are rural and don't have access to the vaccine by virtue of distance, then the viral rates have been what they call the positivity rate has been high, right? in areas where the vaccine is accessible, the positivity rates have been low, right? In places on the African continent, where it's high because people have not had access to the vaccine, right? And so you can map. If you go look at a map, you can see, well, yeah, it's high here, it's high here, MERS is high here, SARS is here, because they don't have access to hospitals, they don't have access to doctors, they don't have access to the vaccine, so.
So if I'm listening correctly, what you're saying is, let's say that as a country, we come together. Let's say as one country, we come together, right?
Mm-hmm.
And one by one, we create an immunization circle for each individual virus that's came out. You saying there's a chance that we can individually start knocking them off the planet?
Absolutely.
Yep.
Absolutely. I mean, we no longer have, things like smallpox, like measles, and all these kinds of things. Measles is actually making an upsurge now, but all these,
they disappear. They just like.
Well, they can go down significantly. And if you have people who have access to vaccinations and who really are not anti-vaxxers, but because we have a significant pocket of people who are anti-vaxxers as well, right? And if you have enough people who are getting vaccinated in a particular society, then the virus goes away because it just has nowhere to go. It has no way and no mechanism to actually replicate over time, and then it disappears.
I like that.
That's what happens in
That's a
society.
nice way to say it and explain it.
I would like to follow up with a question for Dr. Pitt.
How many minutes? Oh, we got 2 minutes. So.
Right now, Miriam Clinic is vaccinating children. What are the ages of the children can be vaccinated now, and how can people find out how to get vaccinated for their children?
So the ages are 5 to 11, right? And we can, if you call one of our numbers in terms of, asking where location is, you can, we would gladly tell you where we will be. We've been doing them in schools, in various public schools and mastery charter schools. And we are starting now to vaccinate at other events. Yeah, and if you, I'm sure you'll be taking down our contact information.
Yes,
And
I will
you
be
can,
taking it personally.
Yeah,
I would like to keep in contact.
sure.
As far as
we need to
the progression of COVID,
I'm
or
letting y'all know right now,
you
y'all-
offer services, so I would
Y'all invited back.
go see Dr. P. You
Please use
can't
that.
get it over here, but
Yes.
he has resources available because that's what you're
what
essentially
we do.
doing, right?
Right,
And
exactly.
that's what we like to offer to everybody that I come across. What do you need? I know somebody that got that. You don't know how to do it? Well, he do, and then you go to this person, and then you can get that.
Right.
Connecting all of the the chains together, so there's no more breakup. You don't have you have continuity, and you get to finish something. We start a lot of things, and then it falls off the book. Right. So
right.
by you providing this education and exposure, it's like, okay, this question answered, this question is answered, but this question is answered just through conversation. I haven't asked my questions, but because us, we have conversed, my questions have been answered.
And we would like to come back
Absolutely.
because we want to take questions from people in the community and answer your listeners' questions.
We gonna set that up.
We'll do it again. I put it out, but those questions that I read, they
We gonna
were
do that. And
really
that's gonna be
from
our social
community.
media
the
push
community.
before that episode
That's what we're
is making sure that we have people
Mhm.
calling
with their
Right.
questions.
and
Right.
that's listening and watching
Tap in.
to tap in.
That's what I said. You want to ask the doctor your COVID question?
That's how we
Yeah.
What is it? What is it? Not the nurse, not somebody
It's
who
done.
is acting on behalf
done.
of. You are going
It's
to
done.
the source, right? Because for some reason, if it ain't you as a community, like you said, the credentials. So,
Right.
but you have been listening to the Gas Station Radio Show today. I want to thank Dr. Pitts. I would like to thank Mr. Joshua and the president of IDAY, Mr. Aaron, for joining today. Thank you for your conversation. It was very enlightening, like for real. Thank you. I enjoyed talking to y'all during the break more than the episode.
Enjoyed it as well.
All right. So you can find us on WJYN 98.5 FM, uptownradiophilly.org, onlineradiobox.com, and we stream live on Alexa. I am your host at Lady Steph. It's been a gas station radio show. Better get your information about COVID because round 2 is not for you. I don't think so.